Hi, I'm Matt Chang from Columbia University, and this is our video abstract that we'll be presenting at DDW 2011. A single-center retrospective review of 119 liver transplants with Hep B core antibody-positive grafts in surface antigen-negative recipients. The demand and shortage of liver transplants continues to increase, and as a result, we are using more extended criteria donor organs, including livers that have been exposed to hepatitis B. However, recipients of these core antibody-positive livers are at risk of developing de novo hepatitis B. Lamivudine has been shown to prevent de novo Hep B after transplant, but this has been primarily in small studies with limited follow-up. There are many other prophylaxis regimens now, including hepatitis B immune globulin, or HBig, and also newer antivirals, but the optimal prophylaxis regimen is still unknown. The purpose of our study was to retrospectively evaluate the effectiveness of antiviral prophylaxis in preventing de novo Hep B. We conducted a single-center chart review of adults who underwent liver transplantation at our institution from 1998 to 2010. We included patients who did not have chronic Hep B that received a core-positive graft. We identified 119 patients, most were men in their 50s, and we had a median follow-up of almost 3 years. The majority had hepatitis C, and a significant proportion also had hepatocellular carcinoma and alcoholic liver disease. Of our patients that received core-positive livers, 52% were given lamivudine prophylaxis, 28% adefovir, 2% tenofovir, and 18% were not given any prophylaxis. Additionally, one patient received monthly HBig for a liver that was core IgM positive and surface antigen negative. However, the remainder did not receive any HBig. At the time of transplant, about one-third of patients were surface antibody positive, one-third were core antibody positive, and nearly half were negative for both surface and core antibodies, also known as Hep B naive. After transplantation, of the patients who were initially surface antibody negative, about half developed a positive surface antibody, but of these it was transient in 61%. 18% developed transiently elevated Hep B DNA levels, but only 5 had significant DNA levels greater than 2,000 international units, and only one recipient had multiple elevated DNA levels. 4%, or 4 patients, would later develop de novo Hep B, which we defined as having Hep B surface antigen positivity. The recipients who developed de novo Hep B were all male and ranged from 30 to 60 years old. They became surface antigen positive anywhere from 1 to 5 years after transplant. When looking by prophylaxis type, rates of de novo Hep B were roughly the same across groups, 3% in those given adefovir, 4% in lamivudine, and 9% in those not given prophylaxis. Of the recipients with known serologies after transplant, all were Hep B naive prior to transplant. One of the potential problems with using adefovir is the risk of nephrotoxicity. While we did not find a difference in creatinine levels pre 1 year and 2 years after transplant, we did find that after transplant, patients on adefovir were more likely to require either a dose adjustment or switch to another antiviral for renal insufficiency when compared to lamivudine. There are a few conclusions that we can make. Currently, this is the largest single-center cohort of core-positive liver transplants reported. We found that antiviral prophylaxis alone, without the use of HBig, was effective in preventing de novo Hep B. The addition of HBig would add substantial cost with little to no benefit for long periods of time, as we had patients in our cohort develop de novo Hep B up to 5 years after transplant. While antiviral prophylaxis was effective, it did not completely prevent de novo Hep B. We also confirmed that patients who are Hep B naive are probably at greater risk for developing de novo Hep B. For the future, larger multi-center studies are needed to determine the optimal prophylaxis regimen to best balance cost considerations, risk of adverse effects, and virus suppression with the concern for resistance. Thanks for watching.